This is a picture test in practical histology of the renal system. You may use the video as a revision for the topic or as a self-assessment tool. For the purpose of self-assessment, pause the video at the beginning of each slide and take your time in reading the question and coming up with the answer. Then replay the video to confirm your answer and listen to further comments and explanations. Which of the regions, 1 or 2, is represented by the photomicrograph on the right? The slide on the left shows a section of the kidney where 1 represents the renal cortex showing multiple renal corpuscles, whereas region 2 is the medulla, where only tubules can be observed. In fact, it is here showing only the base of the medullary pyramid, not the entire extent of the medulla. The slide on the right shows multiple circular profiles of renal tubules. The most abundant of the circular profiles have features of proximal convoluted tubule. The reabsorptive function of this tubule is reflected in the simple cuboidal epithelium with prominent brush border to increase the surface area of the plasma membrane for reabsorption of the glomerular filtrate. The cytoplasm of the proximal convoluted tubule cells is deeply stained because of the high content of organelles, especially the mitochondria, to supply the energy required for transport. You can compare the cytoplasmic stain of the proximal convoluted tubule with that of the nearby distal convoluted tubule. In addition to the proximal convoluted tubule, the photomicrograph on the right shows few profiles of the distal convoluted tubule, which do not show a brush border, thus resulting in larger and more clearly defined lumen. The distal convoluted tubule has less affinity to cytoplasmic stains due to a smaller content of organelles, so they appear lighter than the proximal convoluted tubule. And the distal convoluted tubules, as clearly shown here in the section, are less frequent than the proximal ones because the proximal convoluted tubule is longer than the distal. So there is more chance for that tubule to appear in sections than the distal convoluted tubule. Now, the presence of the proximal and distal convoluted tubule in a section, even in the absence of glomeruli, confirms that the section belongs to the renal cortex, region number 1, shown on the left. Name the cells in A and B. What is the function of each? This is a section of the renal cortex showing a renal corpuscle, proximal and distal convoluted tubules. A is located at the vascular pole of the renal corpuscle. B represents a distal convoluted tubule with a clear lumen in comparison to the proximal convoluted tubule. You can also note that the cytoplasm is not deeply stained in the distal convoluted tubule in B as compared to a proximal convoluted tubule. The cells indicated at B are in fact modified distal convoluted tubule cells. They are taller than the rest of the distal convoluted tubule cells with more prominent nuclei toward the luminal surface. They represent the macula densa. In fact, the area including A and B together is called the Juxtaglomerular apparatus, which is located, as its name indicates, adjacent to the glomerulus. The juxtaglomerular apparatus is formed of macula densa as well as juxtaglomerular cells, which are represented in A. These juxtaglomerular cells are modified smooth muscle cells of the afferent arteriole in the vascular pole of the renal corpuscle. The juxtaglomerular cells in A contain secretory granules of renin. The juxtaglomerular apparatus is involved in the regulation of systemic blood pressure via the renin-angiotensin-aldosterone mechanism, where the juxtaglomerular cells are baroreceptors that monitor changes in the systemic blood pressure by responding to stretching in the wall of the afferent arteriole. Remember that they are modified smooth muscle cells. At the same time, the cells in the macula densa, the second component of the juxtaglomerular apparatus, are chemoreceptors that respond to changes in sodium concentration and the volume of the glomerular filtrate as it flows past them in the distal convoluted tubule. Low systemic blood pressure or low sodium concentration in the filtrate causes release of renin into the bloodstream. Renin converts the plasma protein angiotensinogen into angiotensin 1, which is then converted into angiotensin 2 by endothelial enzyme in the lung capillaries. Angiotensin 2 causes vasoconstriction, resulting now in increased blood pressure. And also at the same time, angiotensin 2 causes the release of aldosterone that acts on the distal convoluted tubule, resulting in increased reabsorption of sodium and chloride ions from the glomerular filtrate. This increased reabsorption of sodium and chloride is followed by increased water reabsorption, increased fluid volume in the blood, culminating in increased blood pressure and glomerular filtration rate, and this will result in reduction in renin secretion. What are the functional characteristics of this type of lining epithelium? Describe the shape of cells forming the luminal layer. This is a transitional epithelium. It is a stratified epithelium that begins in the minor calyces as 2 cell layers and increase to as many as 6 or more layers in an empty bladder like this one. This type of epithelium is distensible. So when relaxed, the surface epithelial cells are not only cuboidal but bulge into the lumen. That's why they are called dome-shaped cells or umbrella cells. The cells of a transitional epithelium have interdigitating cell junctions that permit great distension of the epithelium without damage to the surface integrity. So the first functional characteristic here is that it is a distensible epithelium. Also, functionally speaking, this epithelium is impermeable, so it doesn't modify urine, but is specialized for its storage and passage to the exterior. In this kidney artery injected section, what is the name given to vessels A? Identify the rounded structures. What term is used to describe the location of rounded structure B? Since this is an artery injected section, then it shows the stain in the lumen of kidney arteries and their branches. Let's recall the arterial blood supply of the kidney. The kidney is supplied by a single renal artery which divides in the hilum into anterior and posterior branches, then segmental arteries, then interlobar arteries. The interlobar arteries ascend between the pyramids of the medulla to the corticomedullary junction. Here's the site of the corticomedullary junction where the interlobar arteries branch to form arcuate arteries like this one, which runs into an arc-like course parallel to the capsule of the kidney at the corticomedullary junction. The arcuate arteries give rise to numerous cortical interlobular arteries like this one, which radiate towards the capsule and then branching to form the afferent arterioles of the glomeruli. We can see multiple of such arterioles, afferent and efferent arterioles of the glomerulus, as we go closer to the glomeruli. The glomeruli are represented by the rounded structures like the one in B, because the glomerulus is in fact a tuft of capillaries. The glomerulus B is particularly located very close to the medulla, so it's called juxtamedullary glomerulus. In the medullary region, which is represented by A, there are no glomeruli. The vascular profiles are mainly of the vasa recta, means straight vessels. These straight vessels arise from the continuation of the efferent arteriole of juxtamedullary glomeruli, like the one in B. The efferent arterioles of the rest of the cortex divide to form a plexus of capillaries that surround the tubules of the renal cortex. Identify the space A. What is the type of epithelium in B? This is a section of the renal cortex showing the renal corpuscle and proximal and distal convoluted tubules. The glomerulus is the rounded structure that is formed of a tuft of capillaries and surrounded by Bowman's space, which is represented in A. Bowman's space is in fact the narrow space that surrounds the glomerulus, but due to shrinkage of the glomerulus, which is inevitable in tissue preparation, Bowman's space appears enlarged. The Bowman's capsule has a parietal layer of simple squamous epithelium, which is here represented in B. The podocytes that are surrounding the capillaries of the glomerulus, they form the visceral layer of the Bowman's capsule. Identify the specific structural components A and B. This is a PAS technique. PAS, which stands for periodic acid Schiff, stains carbohydrates and their conjugates. PAS technique stain, like this one, makes it easier to distinguish between proximal and distal convoluted tubules. The brush border, which is made of microvilli, is stained reddish or magenta at the luminal surface of the proximal convoluted tubule, as seen in A. So A is the brush border. Glomeruli, proximal convoluted tubule, and distal convoluted tubules are sharply demarcated at their outer surfaces by PAS, since this is also an excellent stain for demonstrating basement membranes. A basement membrane is not confined to the proximal convoluted tubule like the marker in B, but you can trace the basement membrane also at the periphery of a distal convoluted tubule and the periphery of the glomerulus. Note that the section passes through the renal pole of the renal corpuscle, where it continues as a proximal convoluted tubule. Identify the outlined regions. Here's the region of the cortex where you can see multiple of the renal corpuscles. This is the region of the renal medulla, base of the medullary pyramid. These are sections in arcuate arteries. The outlined regions are called medullary rays, are located in the renal cortex, yet they are called medullary rays because they represent projections of tubules between the cortex and medulla. Mainly they contain collecting ducts in their way into the medulla. Identify the outlined regions A and B in terms of the renal corpuscle. A represents the urinary pole, where the ultrafiltrate exits the Bowman's space into a proximal convoluted tubule. You can see here the beginning of a proximal convoluted tubule. Compare its darkly stained cytoplasm with the cytoplasm of a distal convoluted tubule like this one. B is the vascular pole, where the afferent and efferent arterioles of the glomerulus enter and exit the glomerulus. Multiple red blood cells can be seen in the lumen.